with, evolution can take thousands to millions of years. Where do you think we're at with mobile computing as to when we'll actually see it in full play?
So the question really has to do with the difference in pace between biological evolution and technological evolution. I think technology is evolving much faster than biological evolution. We can get through multiple designs and completely redesign a technological product within weeks, whereas you have to go through, as you state, thousands or millions of years, although it can be rapidly accelerated if you're doing biological models with bacteria. I think you'll start to see these, you'll start to see some of these applications, well, they're already coming out now. And I think the important thing is when you see a vendor's product, you really have to look at it and say, gosh, are they really just taking their old product and putting it out here because they don't want to be left behind? Or are they really trying to redesign their product and take advantage of the capabilities of these newer devices? And so I just really, if you get nothing else out of this, think about it next time you see a new product coming out from any of the vendors. Say, gosh, is this just a placeholder? Or are they really going to do something new? If they're not doing something new, I think that they're going to find themselves in a heap of trouble because there's just too much opportunity here. And survival of the fittest is going to hold true. The good solutions will be bought up or they'll thrive, and the bad solutions are just going to disappear from the marketplace.
Okay, I think we have time for one more.
I'm Brad Shire with Healthcare Partners Medical Group. A lot of your focus was on the hospital side, obviously being an intensivist. How do you see the larger screen size playing out in the exam room? We're a large ambulatory subspecialty medical, multi-specialty medical group.
Yeah, it's interesting. I came back from Toronto mHealth conference and was quoted nationally as being fiercely anti-tablet. I'm not fiercely anti-tablet. I think tablets have a great role in the ambulatory environment. And I think the needs in a large ambulatory clinic are really quite different than the needs are in the hospital. And again, it's finding the right tool for the workflow. So it really comes down to, is a 30-inch screen needed over a 24-inch, over a tablet, over an iPad? An iPad may be the ideal product depending on the clinician's role and workflow. So it's a matter of not making blanket statements, but rather, marrying the tool that enables the workflow. 30-inch monitors in the outpatient environment, in my office, do I need a 30-inch monitor? I'm not usually trying to put together the same kinds of information, the same complexity that I do in the hospital. The issue is, though, how much does it cost for a 30-inch monitor these days? It costs less than what an old 15-inch monitor used to cost. So it gets down to desk space. It gets down to space planning as much as anything at this point. I think the larger screen you have, the better off you are. But
All right, thank you, Dr. Kanter.
Appreciate it. Thank you very, very much. Thanks, Mike. Appreciate it. Charles, thanks.
Thank you.
Appreciate it. Yeah.
Perfect introduction to
Oh, good.
what I'm saying.
Okay. Oh.
I got this for you too.
Good morning. My name is Leroy Smith. I'm the manager for clinical informatics in the community hospital in Valencia, California, and I have the pleasure of introducing Dr. Willard Fields.
Hi.
Good morning. Dr. Fields has been on the faculty at San Diego State University since 2006 and is a professor of the School of Nursing. Willard's diverse background in clinical